Hello everyone, welcome to QAxon. So in this video, you will learn about the types, functions and properties of nerve fibers. We will start with a discussion on the different types of neurons and also learn about the classification of nerve fibers. And then we will discuss a few important properties of nerve fibers. So here we go. Now, neurons can be classified in different ways. We can classify them based on their function, based on the number of poles, based on the length of the axon, and based on the presence or absence of myelin. Now, neurons are communicating between the central nervous system and the periphery. They are bringing in information into the central nervous system and they are carrying motor signals away from the central nervous system. So based on the function, neurons can be classified into sensory or afferent neurons, which bring information into the central nervous system from different receptors in the body. Then we have the motor or efferent neurons, which carry impulses away from the central nervous system. So the motor command signals are delivered to a muscle or gland. We also have interneurons that do not belong to both these categories. They are neither sensory nor motor. They merely connect different neurons in the central nervous system. Now, the first diagram is an example of how sensory information is brought in from the skin. So on the skin, we can feel different sensations such as pain, touch, temperature, and so on. So these signals are brought by the sensory neuron into the central nervous system where it is interpreted. In the second diagram, you have a motor neuron. In this case, it is supplying a muscle. So the motor command signals, which are generated by the central nervous system, are carried by the motor neuron, and this brings about muscle contraction. Now, based on the number of poles, neurons can be divided into unipolar, bipolar, and multipolar neurons. So what is a unipolar or pseudo-unipolar neuron? We have more of pseudo-unipolar neurons. So these neurons have only one pole. So from this pole, you have both the axon and the dendrite. The example you can think of in this regard is the dorsal root ganglion. On the other hand, bipolar neurons have two poles, one for the dendrite and one for the axon. The bipolar cells in our retina are good examples of this. And finally, we have the most common type of neuron, which is the multipolar neuron with several poles. So there are many dendrites and there is only a single axon. There are many examples for this. The alpha motor neuron in the spinal cord, the Purkinje cells in the cerebellum, and the pyramidal cells in the motor cortex are all examples of multipolar neurons. This is how a unipolar neuron looks. You can see that there is only one pole, and this pole gives rise to a single process. This is a bipolar neuron. You can see that there are two poles, one for the dendrite and one for the axon. Here you can see a multipolar neuron with many poles, and you can see that there are multiple dendrites but only a single axon. Now in this diagram, you can appreciate the differences between the different types of neurons. Please note that both the unipolar neuron and the pseudo-unipolar neuron have a single pole. But in case of the unipolar neuron, there is only a single process, whereas In case of the pseudo-unipolar neuron, you have a single process which then splits into a dendrite and an axon. Based on the length of the axon, neurons can be divided into Golgi type 1 and type 2 neurons. So the Golgi type 1 neuron is a neuron with a long axon, and therefore its cell body is inside the central nervous system, but the axon is outside the central nervous system. Whereas the Golgi type 2 neuron has a short axon, and therefore the entire neuron is within the central nervous system. And finally, based on the presence or absence of myelin, neurons can be divided into myelinated and unmyelinated nerves. One useful way to classify nerve fibers is based on their diameter and conduction velocity. This is referred to as the Erlanger-Gaster classification. So this is a representation of the Erlanger-Gaster classification. So as you can see, broadly, nerve fibers have been divided into type A, type B, and type C fibers. And A is further divided into A alpha, A beta, A gamma, A delta. So you can see that the diameters are different, and the conduction velocity of these fibers is also different. So A alpha is the fastest with a conduction velocity of 70 to 120 meter per second. And it also has the largest diameter, 12 to 20 microns. Most of our voluntary motor nerves are A alpha fibers, and that is good because when you wish to contract a muscle, you need speed. So if you want to run, you cannot afford to have a slowly conducting nerve. You need a nerve which conducts fast. The type C is the slowest fiber. Its diameter is only 0.5 to 2 microns, and the conduction velocity is only 0.5 to 2 meter per second. So the best example for this is the fibers which carry slow pain. Now, slow pain is generally the kind of pain that you experience from the viscera, from the internal organs. For example, if you have stomachache, that is an example of slow pain. So in between the type A alpha and C, you have this entire range. So these are the diameters, and this is the conduction velocity. And there are examples for each. So this is a diagrammatic representation of these nerve fibers that we just studied. This is the A alpha fiber with the largest diameter, about 13 to 20 microns. And this is the type C fiber, which has the least diameter, 0.2 to 1.5 microns. Now there is another numerical classification which is exclusively for sensory nerve fibers. So based on this, the sensory nerve fibers are divided into the following types. Now type 1A and 1B exclusively carry sensations from receptors present in the muscle. So this receptor, the muscle spindle, is located in the center of the skeletal muscle. So you have 1A carrying sensations from the muscle spindle. The Golgi tendon organ is located in the tendon of the muscle. So 1B fibers carry sensations from the Golgi tendon organ. Type 2 again carries sensations from the muscle spindle. Also, it carries touch and pressure sensations. Type 3 carries fast pain and temperature, while type 4 carries slow pain.